Hip pain can be debilitating and limit one's quality of life. I will be briefly explaining common causes of hip pain and how you can manage your pain. The hip joint is a strong yet mobile joint which lies between the lumbar spine and the knee. It's a ball and socket joint which allows our leg to move in several different directions. However, it also needs to be strong in order to provide a stable base for the lumbar spine above it and the knee joint below it. In this section, I'll be covering common hip impairments. One of the most common causes of pain in the hip region is due to strains, sprains, tendinitis, and bursitis. These are common conditions of the hip due to the muscles, tendons, and bursa that cross the hip joint. A muscle strain can be caused by micro-tearing of the muscle due to lack of flexibility or overusing a muscle that is weak. Pain can result due to inflammation or swelling. How can a strain occur? Muscle strains can occur in the hip area when an already stretched muscle has to contract suddenly. This can cause a muscle to tear if overstretched too far. In addition, falling directly onto the muscle can cause a strain, contusion, or even bursitis. Overstretching and overusing a muscle can also lead to tears in the muscle fibers and tendons, leading to a strain or tendinitis. Also, lack of properly stretching before activity can be another source of a muscle strain, especially if you've had a prior injury to the area. Lack of warm-up before activity or exercise and doing too much too quickly can also cause a muscle strain. Common areas of strains or tendinitis can occur in the hamstrings, iliopsoas or hip flexor, adductors, and gluteals. Lastly, the bursitis, which is located on the side of the hip, is a common area of inflammation causing pain in this region. Another cause of hip pain can be due to piriformis syndrome. The piriformis muscle can cause irritation to the sciatic nerve as it pierces deep to the piriformis muscle. Here's the piriformis muscle, and the sciatic nerve exits down below it, causing pain in that pathway. Injury to the sciatic nerve can occur during prolonged sitting or due to tightness of the piriformis muscle, which can compress the nerve or cut off blood supply. It can also occur due to imbalances in the muscles of the hip, causing the piriformis muscle to be overused and tight. It's important to note that piriformis syndrome is also different than sciatica, a condition that can be coming from the lower back due to compression of the spinal nerve roots. The third condition I will be discussing is arthritis of the hip. The hip joint is a joint that becomes susceptible to arthritis as it is used repetitively with weight-bearing activities, such as walking and jogging. Over time, this can lead to natural wear and tear to the joint surfaces and can cause pain deep in the joint with compressive or weight-bearing activities. The constant stress placed on the ball and socket can lead to damage of the ball and socket and/or wearing down of the cartilage. Arthritis in the hip can lead to pain in the hip and groin, along with stiffness and lack of flexibility or mobility. Next, I will discuss another common condition of the hip that involves tearing of the labrum. This is also known as acetabular labral tears and can also lead to a condition known as femoral acetabular impingement. The labrum consists of cartilage that lines the inside of the hip joint. It provides a cushion between the two bones and also provides support. Many labral tears may occur without a known cause, however, may be a result of poor hip mechanics, age, and normal wear and tear. On this hip model, the acetabulum is the socket, and the head of the femur goes into that socket. The labrum is on the inside of the socket, and it's a cartilage ring on the inside of the acetabulum. In addition, athletes that participate in sports such as soccer, ballet, hockey, and football are also at higher risk of developing a labral tear due to the high demands on the hip joint. These athletes may develop a labral tear as a result of trauma or as a result of sudden hip twisting motions. A tear in the labrum can lead to pain in the hip and a feeling of pinching, locking, or decreased mobility. Hip stiffness and capsulitis are common conditions that occur in many people with age. This occurs when there is shortening and tightening of the hip ligaments and musculature, which can lead to a significant decrease in range of motion and pain in the hip region. If you're having pain in this region, it is important to not stress this area by excessive activity. Ice can then be applied to your hip as well. This is a great modality to help decrease pain and inflammation. In addition, there are specific exercises that you can perform to help improve the mobility of your hip, loosen your musculature, improve your strength, decrease the pain, and start promoting healing. We've provided you with several exercises that you can perform to help with pain and tightness that you may be experiencing in your hip. If you continue to experience pain or problems in this area, then physical therapy may be your best option. Physical therapy is a very safe and effective way to treat this area of the body. Physical therapy consists of hands-on treatment to loosen muscles and joints, education on proper posture, and movement to decrease pain, instruction on strengthening and stretching exercise to restore mobility and strength, and modalities such as electrical stimulation and ice to help the affected area heal. If the information and exercises provided on this website are not helping and you continue to have pain, please call our office for a free consultation. Our friendly staff will then quickly schedule you for your free consultation with no obligation on your part. It will be a time for one of our physical therapists to sit down with you and perform a brief evaluation to determine the exact source of your pain and what needs to be done to help you.